Hi, everyone. We're just going to give it a moment for folks to connect before we kick things off officially. Okay, thank you for joining HHS's briefing on getting vaccinated this respiratory virus season and the Risk Less, Do More campaign. My name is Betsy Weand, and I'm Public Health Policy Advisor in the Office of Intergovernmental and External Affairs here at the Department of Health and Human Services. This briefing is open to the public. However, the conversation should be considered off the record, and any press inquiries for HHS should be directed to the press office at media@hhs.gov. There will be time at the end for Q&A, so we encourage you to submit your questions using the Q&A function at the bottom of your screen at any time during the briefing. During today's call, you will hear from Dr. Mandy Cohen, Director of the Centers for Disease Control and Prevention, about the importance of vaccinating yourself and your loved ones against respiratory viruses this fall. We'll also be joined by Dr. Peter Marks, Director of the FDA's Center for Biologics Evaluation and Research, about vaccine safety and the update process for flu and COVID vaccines. Finally, we'll hear from Assistant Secretary for Public Affairs Jeff Nesbitt about the latest phase of the Risk Less, Do More public education campaign. And now I'd like to welcome Dr. Cohen.
Great. Hello, everyone. Thank you for joining us. This is Dr. Mandy Cohen, Director of the CDC. Appreciate your time today. We're going to talk about the upcoming fall and winter respiratory season and CDC's updated recommendations for vaccine, but we also want to remind you about the importance of looking at our data and some important other tools we have for you. So first and foremost, I want to remind you, flu, COVID, and RSV, we know are going to be increasing this fall and winter, and we want to help people risk less severe illness and do more of what they enjoy. You're going to hear risk less and do more a lot today. So let's start with what are we recommending. On this one slide, it is your one-stop shop to see everything that we are recommending. And we are recommending that everyone 6 months and older get an updated COVID shot and an updated flu shot. So that's easy to remember. It's everyone over 6 months should get an updated COVID vaccine, updated flu vaccine. And now is the time to do that. September, October, great time to get both of those, and you can get them both on the same day. RSV, there are several types of RSV protection. First, to talk about our babies. To protect our babies, two options here. One is pregnant moms can get vaccinated while they're pregnant between 32 and 36 weeks of pregnancy, or infants can get what's an immunization called a monoclonal antibody, and this is for babies under the age of 8 months or entering their first RSV season. For older adults, there is updated recommendations to make it even more clear about who needs an RSV vaccination. And this is just one vaccine. So if you've gotten your RSV vaccine, you're good. But anyone 75 or older, if you haven't gotten your RSV vaccine, we recommend you get that and get that in the next couple of months. And then people ages 60 to 74 who also have higher risk conditions, things like lung disease, suppressed immune systems, we also recommend you get an RSV vaccine. So that's your one-shot picture of the things we recommend going into the fall and winter season. And remember, the best time to get these is right now. So get in touch with your doctor, your nurse, your pharmacist, your community health center, and make that appointment for the next couple of weeks coming up. Next slide here is about why. Why are we spending so much time recommending it? Because we know that these vaccines are our best defense against these viruses. These viruses continue to put people in the hospital and make them very sick. And we want you to have the best defense you can against these viruses. We know that unfortunately, these viruses, as I said, can cause hospitalizations, and we cannot yet predict with precision who is going to become severely ill. We know people over 65 are 4 to 9 times more likely to be hospitalized, but we also know that children hospitalized with COVID-19 had no underlying conditions. Half of those kids had no underlying conditions. So again, we're not great at predicting who can become very sick, and we know we have a vaccine that can reduce your risk of going into the hospital, particularly if we're looking at RSV. The number one reason for infants to go to the hospital is RSV, and we have two options to protect babies. And again, we know vaccines cut your risk of being hospitalized. And last year, 95% of the people hospitalized weren't up to date on their vaccine. So get that updated COVID, flu, and if you are eligible, an RSV vaccine as well. On the next slide here, just also want to remind you about the updated respiratory virus data that we've put together. So we know there's a lot of viruses circulating out there, but we want you to know what's going on in your community. So we are able to put together our wastewater data, our national trends in a new, easy, understandable format. So you can know exactly what's happening in your community and take precautions. Vaccine is obviously a very important proactive step we can take, but there are other ways we can protect ourselves. Make sure you're reading CDC's updated and streamlined guidance. What are the other ways you can protect yourself? Don't forget about washing hands, ventilation, masks, staying home when you're sick. So all of those are important, and we want to be doing that when we're seeing more viruses circulating. And then last, I need help from our clinical community. This is a big team effort here. CDC is doing our part in recommendations, funding our Vaccine for Children's program, making sure that we are connecting with clinicians. And here is how, if you are a clinician, you can help us as we get into the fall and winter. First, make sure you are ordering and offering vaccines in your clinic. A ton of resources at HHS.gov about ordering, how to make sure you're ordering the different vaccines, and how you can think about embedding them into the workflow of your clinic. EHRs have a lot of ways in which can help do reminders as people check in and they're in the various parts of their appointment. We want to make sure that you are using your very trusted and powerful voice. One of the most important things you can be doing is making a strong recommendation for the vaccine. We are recommending you use language like, I, as your doctor or your nurse practitioner, recommend you get the COVID vaccine today. So that's something we can do today. So make sure that you're talking about it at each visit. And then we talked a lot about vaccines, but don't forget treatment. We have treatment for COVID, for flu that can save a patient's life. It needs to be used early in someone's symptoms. So you want to be encouraging patients ahead of time. If they get sick, get tested, make sure that they are getting in touch with you in your office to get treatment. Things like Paxlovid and Tamiflu, they work to keep particularly those who are over 65 out of the hospital and could save their life. Lastly, I'll just end with a huge, huge thank you to everyone who is working on this. We know that it's really ramping up as we get into vaccination season here. And then as we get into seeing more COVID, more flu, more RSV, we all have work to do to keep folks healthy in our community. Let's remind them, folks in our communities, to risk less and do more, get this season's vaccine. All right, with that, I'll turn it back over to you, Betsy.
Thanks so much, Dr. Cohen. And now I'd like to welcome Dr. Peter Marks, Director for the Center for Biologics Evaluation and Research at FDA.
Thanks so much, Betsy. So I really appreciate Dr. Cohen's remarks. I'd say I'm the Director of the Center for Biologics Evaluation and Research. We're the part of FDA that licenses vaccines in the United States. Vaccination has now been in wide use for about a century in the United States. And despite some of their limitations, vaccines are among the most effective public health measures that exist. Although, some people have questions about them, we have to remember that vaccination has made smallpox to be eradicated, and polio and measles have been eliminated, among other diseases. Today's FDA-approved vaccines are made with high quality and are safe and effective. And they're typically studied in tens of thousands of individuals before FDA approval. And the FDA carefully reviews all the manufacturing information and safety and effectiveness information on these vaccines. That review is among the most thorough in the world and includes review of patient-level data from the clinical trials, as well as inspections of all of the facilities involved in vaccine production. The influenza, COVID-19, and RSV vaccines have been extensively studied, and in fact, over 1 billion doses of the 2 mRNA COVID-19 vaccines available in the United States have now been given. The updated versions of the vaccines for COVID-19 and influenza are now available, and the COVID-19 vaccine for the 2024-2025 season has been updated to more closely match the circulating variants that have been causing the recent summertime surge in cases. There are 2 mRNA vaccines available for all individuals 6 months of age and over, and 1 protein-based vaccine available for those 12 years of age and older. And full information on safety and efficacy is available in the package inserts for the licensed vaccines, and similar information for emergency use authorized vaccines is available in the fact sheets. All of those can be found on our FDA webpage. As for influenza vaccine, the one component previously included B Yamagata out of the quadrivalent vaccines has been dropped because it's not circulating anymore. So everyone will be getting trivalent or 3-component vaccines that will help provide protection against 2 types of influenza A and 1 type of influenza B. And the RSV vaccine obviously continues to be available. And as a reminder, 2 or 3 of these vaccines can be administered as appropriate on the same visit. So finally, I just say that for the COVID-19 vaccines, despite modest differences in the formulations, any of these vaccines is acceptable, and the best vaccine is the one that's taken. So individuals are encouraged to discuss any concerns they have about vaccines with you, their healthcare providers. So thank you very much.
Thanks so much, Dr. Marks. And now I'd like to turn it over to Assistant Secretary for Public Affairs, Jeff Nesbitt.
Great, thanks, Betsy. HHS recently launched its National Public Education Campaign, as you heard Dr. Cohen say. It's called Risk Less, Do More. The campaign is designed to inform key audiences about the risks of respiratory viruses and to empower them to protect themselves from flu, COVID-19, and RSV. The campaign launched during National Immunization Awareness Month in August. It'll run through the winter of 2025. Flu, COVID-19, and RSV vaccines help people risk less. That's the first part of the campaign's name. It'll help people risk less severe illness and do more of what they enjoy. Yet many people are unaware of the tremendous benefits of these vaccines. The campaign aims to reach certain populations who are at higher risk of serious illness, including adults ages 65 and older, residents of long-term care facilities, pregnant people, and those living in rural areas. It also aims to reach Black and Hispanic populations in the United States who are at higher risk. The campaign delivers research-based messages through national paid, earned, and owned media. In September, this month, the campaign will launch 5 television ads, hundreds of social and digital ads, as well as dozens of radio, print, and out-of-home ads. The national television ads will air on the major broadcast networks, as well as Univision and Telemundo, and on 13 cable stations across 12 syndicated shows. One of the campaign ads you might have seen last night, in fact, it premiered on the Emmys on ABC. Our ads will also air during The Late Show with Colbert, CBS This Morning, 60 Minutes, NFL Sunday on Fox, which, by the way, has always traditionally has the largest audience for a mass audience, as well as the PGA President's Cup on NBC. Local TV, radio, out-of-home placements will also start this month in 15 markets. Ads tailored for priority audiences will appear on social platforms that include Facebook, Instagram, Pinterest, Reddit, LinkedIn, and Nextdoor. Through this surround sound outreach across national and local tactics, the risk of more Risk Less, Do More campaign aims to reach 90% of adults aged 65 plus at least once, and on average more than 15 times. To date, the campaign has achieved more than 2 billion media impressions. The campaign is also partnering with more than 40 national, state, and local organizations and participating in more than 100 community and national events. Key activities include social and digital campaigns, virtual events, materials distributed at community events, and nearly 100 pop-up vaccination clinics in priority markets across the country. I'll turn it back to you, Betsy.
Thanks so much, Jeff. And now we have a few minutes left for Q&A. So one of the questions we received that I think is for our CDC partners is, how often can someone get boosted or another shot after their initial dose of the 24-25 COVID-19 vaccine?
Thank you. So for people who have previously been vaccinated and get their updated vaccine this fall, which is recommended for everyone 6 months of age and older, for people with moderate or severe immunocompromised, they can get an additional dose of 24-25 vaccine 2 months after that first dose of the updated vaccine. And if their healthcare provider recommends additional doses, that could be given as well. For other people, there's no recommendation for additional doses of the 24-25 vaccine for people who had already received a primary series.
Thanks so much. Another question for you, Melinda, is how CDC is handling some of its messaging around other mitigation strategies.
Yeah, so so there are recommendations for prevention of respiratory diseases through other strategies like staying home when you're sick, masking under certain circumstances, and so on. I think that this has been an area that has evolved over time, and as we've learned more, and honestly, as population immunity has increased so high in the population.
Thanks so much for that. Another question we've got that might be for you, it might be for some of our colleagues and the Assistant Secretary for Public Affairs, is how would you advise communicating to patients or others who may hear conflicting vaccine guidance and who are confused about how to sort through these competing messages about the risk and value of vaccination?
Well, maybe I'll start. I think that we always want to encourage people to get advice from credible sources, and for most people, the best source of information really is their healthcare provider. There is a lot of information out there, but it's very important that people do get information from credible sources. And of course, HHS and CDC and FDA all have a lot of great information available, as do many of our partners. But often people really do have the most confidence in information they receive from their healthcare provider.
And this is Jeff. I'll just add, the reason why they call it bedside manner for physicians is that all the research says that that the closer you can get to the patient, the potential patient locally, the better off you're going to be. The better they'll receive those messages. So it's why patients wait. They call it bedside manner because they want the physician to be right next to the patient, one-on-one. But I also wanted to introduce May Malik, who she can come on. She's the director of our public education campaign, and she can can talk about this a little bit as well.
Thank you so much, Jeff. I hope everyone can hear me. I'm having bandwidth issues, so I'm dialing in. Obviously heard from CDC and you heard from our ASPA. The only other thing I want to add is that the Risk Less, Do More campaign was heavily informed by providers. They informed the messaging that we're using, the tactics that we're deploying, and our campaign actually has resources specifically tailored for doctors. So we encourage you to tell those doctors to visit risklessdomore.hhs.gov, risklessdomore.hhs.gov. On that site, providers will find guides for having conversations about vaccines, fact sheets that they can give to patients who have questions about the flu, about COVID-19 and RSV vaccines, as well as other resources that they can share with their colleagues. So please encourage the providers in your life to visit risklessdomore.hhs.gov to break through some of these conflicting health voices, as was noted. Thank you.
And I would just like to add that although we've been saying physicians, doctors, I think we will take any healthcare provider as somebody who can help here, because in many cases, we're aware that around the country, the pharmacist or a nurse or nurse practitioner may be the closest that an individual is going to come to having an interaction. So I think the person who can have an interaction with any type of knowledgeable provider, I think that's really helpful in dealing with a lot of the noise that's out there that is not relevant, and helping people to sort through what is relevant.
Thanks. Another question for you, Dr. Marks. I think for you, perhaps for our colleagues at CDC, are there reasons to get one type of vaccine over the other?
Yeah, this is let me see if I can get my camera back on here. Sorry. So in rare circumstances, if somebody has had an adverse reaction to one of the vaccines, for instance, somebody that might have had an allergic reaction to one of the mRNA vaccines, it might be recommended that they get a protein-based vaccine. On the other hand, for the large majority of us who have not been told that we should get one preferentially over the other, I think the right vaccine is the one that you can get now. Okay, so I would say I wouldn't overthink this. Although there are slight differences between the vaccines in composition between the protein-based and the mRNA-based vaccines, that's not at this point a substantial enough difference to get excited about. I would say whatever vaccine is available for COVID-19, that's the one to take. For the influenza vaccine, you should, if you're over 65, you might ask your doctor about whether high-dose influenza vaccine is for you. They may know enough to potentially have that discussion. And I might ask Melinda to make any comment just to make sure that she doesn't, I haven't said anything that CDC would disagree with there.
No, Peter, I think that's exactly right. We do there are certain flu vaccines that are recommended preferentially for people 65 years of age and older. But other than that, I mean, it's totally true. You should get the vaccine you can get.
Great, thank you. Melinda, another question for you. Knowing that a lot of folks got COVID this summer during the surge, including me, when should those folks, including me, be getting their next COVID vaccine?
Yeah, there has been a lot of COVID recently, so there are quite a few people who will have had COVID within the last couple of months. And people who have had recent COVID infection can wait 3 months if they want to receive their COVID vaccine, and they may end up with a better immune response if they wait a little while before they get it, right soon after COVID vaccine or soon after COVID infection.
Thanks so much. Another question for you, and perhaps also for Dr. Marks, is what vaccine should be prioritized first by the public? Is there an order, or like you
Well,
said, co-administration? How
fortunately,
should folks be handled that?
yeah, fortunately, we don't have to prioritize them. If someone is a person 60 years of age and older for whom all 3 vaccines are recommended, then you actually could get them all at the same time if the person you're seeing for care has them all available and you want to get them that way. Certainly, lots of people get flu and COVID vaccine at the same time, but they can all be given at the same time.
And I would just say that it's a great opportunity when somebody is in the office, in the pharmacy. I know that at least for my adult kids in their 20s, it was a great service that when they got their COVID-19 vaccine, someone stuck them in the other arm and they got their flu vaccine at the same time because they were there. The likelihood of getting there a second time a month after they were there was low. So this actually is a helpful thing, I think, just to recognize that these vaccines have now been, there's no concern on the FDA part. All 3 can be given on the same day for the appropriate individual. But certainly flu and COVID-19 are possible. And in the future, it's not available yet, but in the future, they may even be in the same vial, essentially.
Great. Thanks so much for that information. So since we are at time, I think I'm going to wrap up. Thank you so much to everyone who submitted questions and to all of you for joining us today. You may have noticed that we are recording today's webinar and we plan to post it on HHS's YouTube channel later in the week. So we will send around the link once it is live for all those who attended as well as those who were unable but registered. And thank you to all of our speakers and subject matter experts who were on the line for joining us from CDC, FDA, and ASPA. I hope everyone has a great day and a great week.